So, in today's class, we will discuss about hyponatremia and hyponatremia. In that, we will discuss two types of that. So, we know the normal serum concentration. Normal serum sodium concentration is 135 to 145 milliequivalent per liter. So when the serum sodium concentration falls below 135 milliequivalent per liter, it is known as hyponatremia. Another important thing is serum osmolality. Serum osmolality is determined by the concentration of sodium, blood urea nitrogen, and the blood sugar levels. So it is given by the formula 2 into sodium by blood urea nitrogen divided by 2.8 and glucose divided by 80. So sodium plays a very important role in determining the serum osmolality. Also sugar and the blood urea nitrogen. So hyponatremia is basically divided into three types based on the serum osmolality. So hyponatremia is divided into hyponatremia with a normal serum osmolality, hyponatremia with a low serum osmolality, and hyponatremia with a high serum osmolality. So in today's class, we will be discussing about normal and high serum osmolality. Hyponatremia with a normal serum osmolality has already been described in another class which is known as pseudo hyponatremia. Here there is no hyponatremia actually, but it is because of other conditions the measured values will show falsely low, so pseudo hyponatremia. And hyponatremia with high osmolality occurs in conditions whether like hyperglycemia, mannitol therapy, patient who has undergone mannitol therapy, and also patients who have propylene glycol poisoning, or also it is propylene glycol is a part of many IV drugs. So if there is propylene glycol intake hyperglycemia or mannitol therapy, patient will have a hyponatremia with a high serum osmolality. So we know that the serum osmolality formula itself has RBS. So RBS anyway, if it increases, the serum osmolality will increase. Before discussing further, let's have a look into the how the extracellular and the intracellular and volume is distributed. In our body, the extracellular volume constitutes 40% and intracellular volume constitutes 60%. And the major extracellular cation is sodium. So in this diagram, these orange dots indicate sodium and these purple dots inside the intracellular compartment indicates the potassium. So here it is shown in proportion, that is 40 is indicated by 8 sodium and 60 ICF is indicated by almost 12 potassium. So this is how the normal extracellular and intracellular fluid distribution and cation anion distribution, cation distribution and normal condition. So what happens in hypertonic hyponatremia? So hypertonic hyponatremia, that is high osmolality hyponatremia due to high osmolality occurs when there are substances in the extracellular fluid which cannot diffuse into the intracellular fluid. So these substances when present inside the extracellular fluid will draw water from the intracellular fluid towards the extracellular fluid, and as a result there is an expansion of the extracellular fluid and also the serum osmolality will increase, but the sodium concentration will decrease. So here we can see that there are 1 2 3 4 see here there are here we can see This is one, 2, 3, 4, 5, 6, 7, 8 sodium is there. That is the orange dots. In addition to that, there are some big molecules which is present in the extracellular fluid. It is not able to diffuse into the ICF. But what it does is it draws water from the intracellular fluid into the extracellular fluid. So that will result in reduction. See here, there the ICF is up to here 60 percentage, but because of this water is being drawn, this volume has reduced. ICF has reduced, and the potassium concentration relatively has increased here. But since the water has entered from the ICF into the ECF, the ECF volume has increased actually. ECF is supposed to come only up to this line, but the ECF has expanded because of the water is being drawn by the large molecules. So this because of the relative water retention, there will be the sodium dilution happens and hyponatremia results. Here the osmolarity will be high because of the big molecules, that is the glucose, mannitol and the propylene glycol molecules will add to the osmolarity. So these are the types of hyper osmolar hyponatremia or hyponatremia with a high osmolarity. We will discuss about hyponatremia with a low osmolarity in our next class. Thank you.